Ovarian dysfunction, blocked fallopian tubes, disease of the womb. These are among the leading causes of women trying to get pregnant, but when things are not working out. If you are trying to get pregnant, you are a woman, you've done all the tests and the doctors are telling you that you actually have blocked fallopian tubes. These are among the leading causes of women failing to get pregnant. In this video today, we are going to discuss what has been stopping you to get pregnant and how can you get pregnant faster naturally. Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel. On this channel, we do create awareness about fertility and reproductive health. So if you have been trying to get pregnant, the main issue here is that you could be having issues with your ovaries. You could be having what we call ovarian dysfunction, or you could be having other conditions that affect your ovaries. For example, primary ovarian disorders or primary ovarian failure. If you have primary ovarian failure, your ovaries will actually fail to mature. They will fail to produce a mature dominant egg, also known as a Graafian follicle. So you actually need to see your doctor, who will request some tests. The commonly asked question or the commonly requested test is what we call the pelvic ultrasound scan. Your doctor will do the fertility pelvic ultrasound scan on the 13th day or on the 14th day. If at all this scan is done on the 13th day or on the 14th day, there are high chances that your doctor will not be able to detect a mature egg. All the eggs will be very small, but they will be failing to mature. We call this primary ovarian failure. So, are you a couple, you have been trying to get pregnant, but things are not working out? You should actually have yourself get checked out. There could be a problem with your ovaries. There could be a problem with your fallopian tubes, or you could even be having disease of the womb. Tuli kwogera ku biki ebisobola okubanga biremesa omukyala okubanga afuna olubuto. Tugambye nti ayinza okubanga alina obuzibu n'amagige gye tuyita ovaries, ayinza okubanga alina obuzibu n'ensekeze ng'ensekeze aziba, oba ayinza okubanga alina ebirwadde ebyannabaana. So we are talking about what has been preventing you from getting pregnant, and remember to subscribe so that you do not miss any new videos we release every day. The question was asked by one of our viewers here on YouTube, and she said she has failed to get pregnant. She has failed to conceive despite doing all whatever has been asked by, whatever has been advised. She has failed to get pregnant. According to my answer, according to my advice, the best advice I'm giving is that you actually need to first of all identify what could be causing this, what could be preventing you from getting pregnant. The issue is it could be your ovaries. Your ovaries may not be functioning very well. We call this ovarian dysfunction. How can you know that you have ovarian dysfunction? You simply have to do some tests which will be requested by your doctor. But the commonly requested test, or the common test which is always advised on, is what we call the AMH test, or the anti-Mullerian hormonal level test. This shows how fast your eggs growing, and if they are growing, are they of good quality or they are of poor quality. So your doctor might request for the AMH level test. Remember, we've said this shows how your eggs are, whether they are really of good quality or they are of poor quality. Your doctor may also request for what we call the follicle stimulating hormonal levels. Remember, in our previous videos, we've talked about the FSH, or the follicle stimulating hormone, and we've said that this specifically is produced by the anterior pituitary gland. This is a small part which is located at the mid of your brain, and this actually is stimulated, or it is activated by another small part of the brain known as the hypothalamus. So the hypothalamus releases what we call the gonadotropin releasing hormone. This goes on and then it stimulates your anterior pituitary gland, which will produce the two fantastic hormones. These are the FSH, which is known as the follicle stimulating hormone, and also the luteinizing hormone. The follicle stimulating hormone, specifically, it stimulates or it tells your eggs to actually grow through the stages, and then when they are ready on the 14th day, there will be activation, or the next hormone we've talked about, the luteinizing hormone or LH, will now be released in your system, your body, and then LH will actually now cause the release of the mature egg. So if you have tried to get pregnant and things are not working out, the most important points you need to take from this video lesson about fertility is that you could be having an issue with your ovaries. Please do not put the blame on yourself. Do not put the blame on someone else. You could be having what we call ovarian dysfunction. You could also be having an issue with blocked fallopian tubes, or even you could be having disease of the womb. Your endometrium may not be of good thickness. We call this poor endometrial thickness. The endometrium is the inside of your womb. Just like you can take an example of an avocado, which actually has the 3 layers. The outer layer, which is normally peeled off, is what we call the perimetrium, if we are referencing the uterus. And then the middle layer, which is normally eaten, the middle layer which is normally eaten, the middle layer of the avocado is what we call in the terms of the uterus, is what we call the myometrium. Now, the inside, where the seed of the avocado grows, in this particular reference to the uterus, the inside of your womb is what we call the endometrium. So, if you have disease of any of those parts we've talked about, you have disease of the outer wall of your uterus, maybe there could be fibroids. Remember, with fibroids you can still get pregnant, but if at all these fibroids are very many, they can actually cause difficulties in getting pregnant. They could also, if you get pregnant, they could actually increase your risk of getting what we call an ectopic pregnancy. So we are answering the question, someone has tried to get pregnant, but she is not getting pregnant. What is the problem? I hope this has been answered very well, that the failure to get pregnant could be due to ovarian dysfunction. It could be due to blocked fallopian tubes. It could be due to disease of the womb. And then also it could be connected to stress levels. Remember, we've said that stress specifically lowers the fertility hormones. It actually causes what we call hormonal imbalance. And lastly, it could be an issue with your partner. If you do these tests, you as a woman, you do these tests, all the tests, and then the tests show that you are very okay, the ovaries are functioning very well, you have enough levels, or your AMH levels are within the normal ranges, your fertility hormonal levels, that is FSH, LH, progesterone, all of them, if they are normal, then you actually will need to have your partner, your husband, get tested. In men, normally what we recommend, your husband will do what we call a fertility hormonal screen test. Your husband will do what we call sorry about this. Your husband will do what we call a semen analysis test. Sorry about this. So when your husband does the semen analysis test, this is a test whereby a small amount of sperms from your partner will be taken, and then they will be analyzed in the lab. They will be analyzed for the quality. And if your husband has issues with their sperm count, if they have what we call low sperm count, or they have sperms but they are actually of poor morphology or poor appearance, they are actually weak sperms, then your doctor will advise on what needs to be done. Normally, what will be advised on is, you will be advised on dieting. Remember, a diet that is rich in vitamin E, it's really very important in improving your sperm count. It's also very important in improving the egg quality. So if you are a lady and you have an issue with low eggs, poor quality eggs, then you should think about starting on multivites or preconception therapy. This is the therapy, or this is the treatment which you will take that will prepare you. It will prepare you for pregnancy. So normally we advise on vitamins, that is vitamin C, vitamin D, and then also vitamin E. But the B vitamins, including folic acid, including vitamin B complex, these are also very essential in helping and improving the egg quality, that is the eggs of the woman. And then also it is very important in improving the sperm quality, the sperms of your husband. So if you have tried to get pregnant and things have been difficult, then there are high chances that all these could be contributing to this. So you need to have all these tests done, and then you'll be able to get pregnant. So next question asked by one of our viewers is, what can I do for me to have, what can I do to have my menstrual cycles every month? One of our friend is asking a question, what can I do for me to have my menstrual cycles every month? So in this particular case, we presume that she is having issues with her menses. She's not seeing her menses. We call this amenorrhea. It could be total or it could be partial amenorrhea. So